My name is Vivian Rogers, and I am the nurse practitioner and the program coordinator at North Mississippi Medical Center Bariatric Center. Today I will discuss the advantages of having surgery at North Mississippi Medical Center. I will discuss who is the candidate, the criteria for bariatric surgery, and later on in the video I will discuss the expectations for follow-up. The advantages of having surgery at North Mississippi Medical Center is that we are a center of excellence. We participate in the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. This program is established by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. We provide a multidisciplinary team approach committed to long-term success of our patients. Our staff includes the surgeon, Dr. Terry Pinson, who is also the medical director, program coordinator, nurse practitioner, psychologists, registered nurses, dietitians, exercise physiologists, and other administrative staff who are very committed to your long-term success throughout your weight loss journey. Well, who is a surgical candidate? First, you must meet the National Institute of Health criteria. You must have no endocrine cause of obesity. You must be an acceptable operative risk. You must understand surgery and its risks. It is very important that you have researched bariatric surgery and very aware of its risks, complications, and the benefits. No alcohol or drug problem, no uncontrolled psychological conditions, and you must be dedicated to a lifestyle change and follow-up. This is not something that you just do for the first year. This is a program that you do lifelong. The NIH Consensus Conference of 1991 states that patients should be managed medically prior to surgery, which means you must have a primary care provider or someone who has been monitoring your care throughout this process. Gastric restrictive or bypass procedures are appropriate for motivated patients with a multidisciplinary team approach, which I feel that we have here at North Mississippi Medical Center. Lifelong medical surveillance. Surgery is the only approach that provides consistent permanent weight loss for morbidly obese patients. Surgery is indicated in patients with a BMI or body mass index of 40 or over, a BMI of 35 to 40 with significant comorbidities, and of course documented dietary attempts that have been ineffective. Later on in the video, you will see a link to where you will get an understanding how bariatric surgery is also available for patients who could have a BMI lower than 35. The bariatric surgery evaluation. First, you must complete a bariatric seminar prior to your initial consultation. After the bariatric seminar, you will be contacted to schedule your initial consultation. Have a primary care clearance. And this is a referral letter from a primary care provider or someone who's been monitoring your care throughout your history. Complete a nutritional assessment. You will visit with the dietitian prior to your surgery and also multiple times after your surgery. Exercise assessment. This will be done during your pre-surgery education, and this will be a little later on during your process when you're about to have surgery. The psychological evaluation will be done prior to surgery, and that will be done there at the office, and additional testing may be required based on your current health status. We also ask that you participate in one weight loss support group meeting prior to your surgery. This is held on the first Thursday night of each month at the Wellness Center in Tupelo, Mississippi from 6 to 7 p.m. Now, the bariatric preoperative evaluation also includes a medical history. We would like a detailed account of efforts to achieve weight loss by non-surgical methods. We also ask that you list any specific comorbidities or disease processes that you have. We ask you list your past surgical history, family history, and a list of all medications, including prescription and those over the counter. We also ask that you provide a referral letter. Also ask that you document any physician stating the previous weight loss efforts that you have tried in the past. Medical testing. This is something that will be based on an individualized basis. Depending on your comorbidities, there may be tests that will be ordered and may not be ordered for some. Weight management may be required depending on your insurance company and based on their specific criteria. The preoperative requirements. First of all, if you use tobacco, you're a smoker, you need to stop. We require that you stop smoking 2 months prior to surgery, and we ask that you do not resume smoking after the surgery. Start an exercise program. It's very important that you start this prior to your surgery and do not wait till after you have the surgery. You need this time to build your endurance up so you're ready for surgery. If you have sleep apnea and have a CPAP device, it is very important that you are compliant with this device prior to surgery, and you must bring this device with you the day of surgery. Pre-surgery diet. This is something that you will have 2 weeks prior to your surgery. It will be consistent of high protein and low carb. Also, you will be on 4 days of liquids prior to your surgery and be required to do a bowel prep and take preoperative antibiotics the day before your surgery.